So we'll decrease in density as we go back, so it fades out into a natural pattern of thinning, but most of the density at the front. So this density will build up upon the previous density. In other words, shingle, so as to increase density at the front. We're going to be doing some incisions now, what we call the recipient area. In other words, the area of thinning that we want to put the hair in, that's called the recipient area, as opposed to the donor area, which is where we've taken the grafts from. So I'm just getting slightly different magnification here, because it's a different end of the procedure, so that we can see where to place the incisions. So this is the area I've designed into boxes so we can count the number of grafts per box, trying to have higher density here at the front with reducing density towards the back. So this, what we call an internal hairline, so this area at the back will fade out so it doesn't look like a solid block of hair, which would look unnatural. So it's got to look very natural for people. So everything's totally numb, and we just need a bit more tumescence here. We do what they call a test incision. So we can determine the right angle, the right depth, and the right size of blade. So these are test incisions, because we want to make sure that the incision fits Kenny's grafts specifically. Because everybody's graft sizes will vary. So we want to make sure that we've got the right angle, the right depth of incision for those grafts. If it's too shallow, the grafts will be popped out. If it's too deep, you'll get problems with complications of overgrowth of the skin. So we've got to get it just right. It's got to marry up with Kenny's native hair, or in this case, Kenny's transplanted hair, so it all looks nice and blended. So Joanne's just putting some grafts in to see which of these incisions is optimal. So I've made them slightly different angles, and we'll see which one is best to grip the graft and at the right depth for the graft. So we've just done 2 test incisions to see which is the right angle and the right depth for the grafts here for Kenny, and we like the one on the right there on the outer aspect. It's because that's a bit more bespoke and the graft fits more comfortably in that type of angle. And we obviously angled the incisions to marry in with his existing hair so that it's bespoke for the patient.